A sprain is an injury to the ligament. A ligament is the piece of tissue that connects bone to bone. So think of a twisted ankle. A strain is an injury to the muscle or a tendon. A tendon is a piece of tissue that connects muscle to the bone. So think of muscle pulls and sort of cramps when kids are out playing sports like basketball or football. And finally, a fracture is a broken bone, and sometimes it could be a partial break, what we'd typically call a green stick fracture or a complete break, typically after a traumatic incident like a fall or a motor vehicle accident. The most common fracture that we see in children are green stick fractures, and these occur because children's bones are slightly different to adults in that they are a bit more flexible and they tend to bend a lot more before they break. So they end up with partial breaks, which are the green stick fractures, rather than the full breaks. And the other common fractures we see are what we call Salter-Harris fractures. And those are fractures that occur on the specialized ends of bones, which we call growth plates. So that is where children's bones usually grow from. And it's very important for us to take care of these Salter-Harris fractures, because if we do not manage them properly, they might impact how the child's bones will grow later in life. Number one, please don't assume all of these injuries are sprains. So the thing is, come to hospital as soon as your child is complaining of lots of pain, if you've noticed there's swelling at the site of injury, or if you've even seen a piece of bone sticking out of the skin. So we'll assess your child and we'll always ask for x-rays just to make sure that we don't have a fracture. If we do detect there's a fracture, we will put a cast, or we might also consult with orthopedic specialists for further management. If you do have a strain or a sprain, most of the time we'll just allow your child to go home. But what we'll recommend is lots of rest, meaning that your child will not use the arm or the leg for the duration that they're recovering from. The other thing is using of ice, which will help reduce the swelling and also reduce pain. If you're using ice, please ensure that you're not applying it directly to your child's skin. Please ensure it's covered with a thin piece of towel so that we do not cause further injuries. And also we recommend the use of compression bandages, which will help support the joint that has been affected. And last but not least, elevating the limb above the level of the heart just to reduce the swelling. Of course, without saying pain medication, but we use this with the guidance of your pediatrician. Recovery means that they will not be able to use the arm or the leg for a specific duration of time, and typically it's until the child is able to use the arm or the leg without any pain and without the use of any pain medication. If they are participating in sports, they might have to take a break until they're probably also reassessed by an orthopedic specialist if they've developed a fracture. If they're not treated early, especially for fractures, and especially for Salter-Harris fractures, which affect the specialized ends where the bones grow from, it might actually lead to what we call bone arrest, and you might find that the limb that was affected might be shorter than the other normal limb. Sometimes you can also have bone malalignment, where the bone might heal in an improper manner, meaning that the fracture pieces were not in line and end up with a deformity of the arm, which might impair their normal daily activities. So that's why it's imperative to always consult with a medical practitioner whenever you suspect that your child might have gotten a sprain, a strain, or a fracture. Children are naturally curious, they're always up and about and exploring things, and sometimes we're not able to prevent a lot of these injuries. But there are still some ways that we can keep our children safe. Number one, while they're playing, please ensure that they're wearing protective gears, that's helmets, elbow pads, and knee pads where appropriate. Please ensure that there's always an adult that's supervising the children that are playing, especially in the playground. And of course, ensuring that their environment is safe. But most importantly, allow your child to have fun.